So my daughter was diagnosed with brain cancer a couple of years ago, shortly after she turned 2. And we were sent off to Oakland and she had brain surgery, and we were really excited to find out that she was able to have her chemotherapy through a clinic here in Reno, which was offered through Children's Hospital Oakland. And at some point in time during her treatment, Oakland started to lose its funding for this clinic that they were running in Reno.
When we learned in August of last year that there was a possibility that the Pediatric Hematology Oncology Service was going to have to leave the community, it was time for us to get together.
Consortium includes Renown Health, St. Mary's, Carson Tahoe, the county, and the Access to Healthcare Network, who have all come together to form a consortium that focuses on the needs of the pediatric cancer patient and their family. Our goal is to make sure that for those kids stricken with cancer, that we keep them here for their care.
It's the first of this sort. It's exceptionally important, and I think without the collaboration, this service would likely go away.
One of the main issues that we needed to talk about was how to sustain a practice that was probably never going to break even. That every single month these entities would have to put money into the till, so to speak, so that we would be able to have this practice for these children. And they have willingly put their money where it has been so desperately needed to be able to have a full-time practice in Washoe County.
At one time, the physician actually did clinic in Carson City, and we expect that to be part of this new entity.
It is important for the community, it is important for St. Mary's, and it's important to me personally that we provide care for the youngest, the smallest, and the most vulnerable when they're going through difficult treatment times.
We know that many of these families don't have the financial means to go out of town, incur the costs of travel, once again the emotional cost to go out. And it's our mission in social services to help these individuals receive the care that they need in our community.
Not only is it more cost effective, it is an appropriate model that I hope we will be able to apply to other settings as we move forward.
Going through chemo is hard, and your child is sick afterwards. You know, you sit there all day and you get an infusion, and then your kid is sick. They're sick afterwards. And to be able to be in Reno, you know, close to where we live, and to be able to go home at night and to, you know, treat my daughter and the sickness that she felt at home and in her own bed, and have her sleep in her own bed, versus having to drive to the Bay Area, spend a whole day getting treatment, and probably stay the night and deal with that. It just made all the difference in the world. It took a situation that was awful already, and it made it bearable.